cells to increase the gastrin, which this comes from the chief cells. I will write this down more about that later. And also you can see in red I have all the inhibitory ones, the negative feedback. So from here, when we have a lot of acid secretion, this sends a feedback here to the somatostatin releasing cell to release somatostatin so it can stop the ECL cell and the G cell and the parietal cell to stop producing the HCl, or stop stimulating histamine to stimulate the parietal cell to produce HCl. So I hope that kind of made sense a little bit more. But if you try to try this on your own and talk through it with yourself, it will make more sense. Now let's talk more about the bombasin. So a little bit about the bombasin. It is a 14 amino acid long chain. It's isolated from the fire-bellied toad called Bombina bombina. It's in the brain. It reduces food intake via negative feedback. And as we saw in the picture before, here, the bombasin acts on G cells to increase the release of gastrin, to increase the release of high acid secretion. It also has two homologs, neuromedin B and gastrin-releasing peptide. So we have two more secretions that we need to know about. We have the gastric protein secretions, which we touched upon when we talked about the chief cells. It's the pepsinogen, the zymogens made by chief cell. It works best at a pH of 3, and it is activated by HCl or autocatalyzed by pepsin. So if we have a lot of pepsin going around, it can activate pepsinogen again. And this has the stimuli are cephalic and gastric phases, increases secretion via vagus input or via stretch in the stomach or the smell, taste, thought, or talk of food. And possibly the intrinsic reflex that increase pepsinogen as acid increases. The increase of CCK and or secretin may increase secretion. Also, we have the intrinsic factor secretions, which are made by parietal cells. These are very important for B12 absorption in the ileum. If you do not have these intrinsic factors, then B12 cannot be absorbed, and you would have to get injections right into the blood. Usually older people have to get injections as they lose this intrinsic factor. The regulation is poorly understood. It's known that its release is stimulated by histamine and cholinergic agents. So now all we have left to talk about is the gastric injuries and inflammations, which I will put up. So we have gastritis, which is all the conditions involving inflammation of the lining of the stomach. So it's a broad general term for all these problems that we will be talking about. There are 3 types of gastritis. We have the acute, which can be solved easily. Then we have chronic. It's harder to resolve, but there's a possibility of resolving it. And then we have the hypertonic, which is pre-malignant growth of the mucosa, which leads to cancer. So this is not one we ever look forward to at all. And so some common causes are the Helicobacter pylori. So more about the H. pylori is that it's in the stomach, occurs in the stomach or upper GI tract. It's a mild gastritis no long-term damage. There's acute discomfort, which is resolved easily. Sometimes it's not present till very chronic. About 50% of the cases of gastritis are from H. pylori. When it's chronic, there's severe inflammation, loss of parietal cells and G cells, which lead to death and atrophy of the stomach mucosa. And then there can be hypersecretion of gastrin, which increases acid production, and then death of the mucosa. And then what the Helicobacter produces, a urease that reacts with the hydrochloride and makes ammonia in the stomach, which is what's dangerous, the dangerous part of this for the H. pylori. About 85% of these cases are asymptomatic and 50% are chronic after 60 years old, so we usually do see it in older people. The treatments for it are antibiotics and probiotics. We need the probiotics to make sure some of the good bacteria isn't wiped out of our stomach. And also, the treatments for it is Pepto-Bismol. And actually, the guy who found this H. pylori, he found it very early on in rats and pigs, but the science board said they needed more research, so he actually scraped off the bacteria himself and drank it. And once he got it, he had his partner to help him with the research, and they finally approved. And just recently, in 2005, they got a Nobel Prize for the research they've done for H. pylori. We also have NSAIDs, which are non-steroidal anti-inflammatory drugs. So these are the ibuprofens and aspirins we can just take over-counter. About 31 to 60% of gastritic cases are from the NSAIDs. The NSAIDs inhibit inflammation and prostaglandins. The inhibition of prostaglandins is not good because the prostaglandins, what they do is that they stimulate mucus, and they have the synthesis of bicarbonate. So we will have a low amount of this bicarbonate and mucus if we have an inhibition of the prostaglandins. And we do not want that. So the best thing to do is to stop taking the NSAIDs, or take a lower dose of them, or start taking antacids like Rolaids or Tums would help with this. Also, there are chronic gastritis, which are caused by autoimmune disease. About 20% of cases are from this autoimmune disease. It's when the immune cells target and destroy and damage parietal cells. It can be seen in type 1 diabetes patients. It's because of neuropathy. They have no stimulation of the parietal cells, so that damages the parietal cells to releasing the sufficient amount of acid. And also the Graves' disease, which is an overproduction of thyroid hormone, relates to the parietal cells being damaged. Another chronic gastritis is the intake of high salt and nitrate diets, which you can see the nitrate diets are ground meat products. If the color of the meat is red, they most likely use that nitrate. The mechanism is unknown, but we know that the cause is gastritis. Some of the treatments for this, the chronic gastritis, are selective vagotomy. It reduces acid production. It should be combined with an enterectomy to reduce gastric secretions. The dangers of this is that of having an uncontrolled GI function. because you are having a vagotomy, and that basically takes away a lot of your stomach functions that your brain usually controls, your vagal nerves control. Also, you can take antacids, the Rolaids and Pepto-Bismol and Tums. And some of your doctors can give histamine receptor blockers. They're known as Tagamet or cimetidine. Also, there's proton pump inhibitors known as omeprazole or Prilosec. So these are just some of the treatments we can have for chronic gastritis. And that is all we have of the gastric inflammation and injuries. Thank you.